Furthermore, we think that it's only logical that if this were done, that one would develop and submit reports to a cognizant agency, and that the data be obtained by somebody who is credible. That the outcomes be modeled in advance so that we, at least, if this is to be continued, so that at least we do it in places where it would be known in advance it might be reasonable to do. And that the minimum parameters, and here we suggest an expert panel, but if it is to continue, the minimum parameters for continuing would be measuring pH, acidity, alkalinity, some organics, and there, that would really take an expert panel. And for primary drinking water standards, things like antimony, arsenic, lead, and selenium. For arsenic and lead, most of us, I'm a physician, but I do environmental health primarily. Most of us don't know how critically near to the border of having a problem with arsenic and lead. All of us are all the time anyway. That's just the way nature made it, okay? There's not a lot of room for error with those two elements. Secondary include aluminum, certainly iron, manganese, and total dissolved solids. Health. There are no data that are currently publicly available that we could submit to the National Institutes of Health as preliminary data, which would allow us to get a grant to study this. So what I'm saying is we do not have, at this time, the preliminary data to get the federal government interested in a very large-scale study. Health studies do address numerous kinds of pollution, and many, many different types of pollution, air pollution, water pollution, have been studied. Air pollution in this region and elsewhere, water pollution primarily elsewhere. The absence of a health study, of a large-scale, federally funded, quality-assured, prospective human population study for coal slurry waste, injected or otherwise, is a data gap. And it's a data gap that is alarming to those who perceive they are affected. Whether it's important or not, our evaluation does not answer. The data are insufficient at this time to answer. If such a study were to be done, we are talking about something that is big, because there's a statistical sampling requirement, as well as the cost of doing these studies that work together to make this a difficult process. It would take very substantial advanced planning to answer the question concerning whether there is a public health hazard. It would include the identification of reference populations for comparisons. It would need enrollment of a population of sufficient size to achieve statistical power. There would be concomitant environmental measures, including measures within people of what we call biomarkers in serum or urine or saliva. And it would take a substantial time frame both to collect the data, because humans don't age at the time that we can decree a report will be due. They age at their own pace. And it would take substantial time to analyze the data once they're collected. The barriers to that kind of study are cost, extremely large, the absence of preliminary data for a competitive submission, an interested agency. The USGS is interested in working with West Virginia, and they may provide some seed money if we find the right partners to work with them. But that would only be beginning of preliminary environmental data. And of course, there's a population context as well. There is an inadvertent and very real federal bias that makes it harder to study human populations in rural areas or in areas that are less diverse. And so even though we have a poor population which is impacted by environmental problems, they are harder to study. That includes both the majority and minority populations because of the lack of diversity and because of the rural nature of the state. So, to review. We did not document a health hazard. We did document exceedances of secondary drinking water standards to which, logically, this process does contribute. No primary drinking water standards were exceeded. Secondary were exceeded. This does not imply that the safety of this process is assured, or for that matter, even measured in the before, during, and after manner. And each site is unique. It is not reasonable to think that if we measure at one site that it will predict necessarily what will happen at others. It can help us, but measures would be needed at each place that this and similar processes are done. And Data gaps have to be very dissatisfying to the industry, to the potentially affected communities, and to you listening. They are the reality that we face today. Other questions?
My question relates to the issue of how do you determine whether the public health is affected or not. What metrics, if you were designing a study, what metrics would you use to answer that question?
Thank you, Senator. It would be hard. You would get a population that you would enroll, you would follow it over time, and you would need a carefully selected control population, and you would need biomarkers in both. And even then, I promise you there will be some uncertainties because we're not talking about laboratory rats, we're talking about people. So it's doable, it's a big project, it's expensive, and it would take a lot of thought to make it right.
So you would be looking simply at accumulation of these particular elements in the humans, or are you looking at outcomes, health outcomes?
I would look at both. And of course, for health outcomes, the N, the number of people you have to enroll, becomes instantly extremely large. And you have to define the a priori outcomes of interest, as you know. So, yes, it's the right question. Not an easy thing to do. It would be a difficult sell to a federal agency, both because of its scope and its cost and its unknowns as well.
Thank you very much.
Other questions? Senator Clark?
You've done a great deal of, given us a great deal of information on the various chemicals that would be involved. Is it not possible to make some sort of hypothesis when we've got all kinds of studies out there that affect the arsenic and barium and all those are on both humans, young people, babies, horses? We've done it in poultry areas. Are there no hypotheses you can draw from studies that have already been made?
I think the general question is more or worse. I think the general, I mean, I don't mean to simplify it down to it's too much, but with things like lead and arsenic, more is worse. There are new data about arsenic, which we're not yet sure are right. They have to do with the incidence of diabetes, for example. And those data are alarmingly close to drinking water standards. So if the hypothesis presented in those preliminary studies are correct, we do want to make sure that we have as little arsenic, for example, in our water as possible. But that's not a unique issue to cold slurry injection. That's an across-the-board issue. It's a big picture question. Okay. But yeah, arsenic is dangerous. Lead is dangerous. Selenium is both good and bad, as you know. And so, you know, it just goes by the chemical. And there is a big section of that very big document that is devoted to that issue. What that section doesn't tell us is what to do. It only tells us what are the risks.
Senator Ross?
Thank you, Mr. Chairman. Doctor, how does the water coming off the cold slurry compare with the water being taken out of the Allegheny River, the Monongahela River, prior to going through the treatment plants in Morgantown, in the Pittsburgh area?
Oh, it's substantially different in respect of having higher concentrations of antimony, arsenic, and lead. You simply don't see that in, for example,
You don't see it in the river water.
I look at the river water pretty regularly.